Okay, so let's continue with Chapter 42, Part 5, The Child with Cardiac Disorders. We're going to take a look at bacterial endocarditis, bacterial infective endocarditis. It's an organisms enter the bloodstream from any site of localized infection during invasive procedures or during dental work. The microorganisms grow into the endocardium, forming vegetations on the tissue, which may invade the nearby valves. Vegetations may break off and embolize anywhere. You want to look at box 42 for clinical manifestations of bacterial endocarditis or an infective endocarditis. Treatment should begin immediately. It includes high doses of appropriate antibiotics for 2 to 8 weeks. Nursing care includes parent education regarding the risk of bacterial endocarditis or ineffective endocarditis, and include education regarding prophylactic treatment needed prior to invasive procedures or dental work. Then we have rheumatic fever. It's a systemic autoimmune disease that involves the joints, the heart, the CNS, the skin, and subcutaneous tissue. Its common characteristics of RF is destruction of connected tissues, causes scarring of the mitral valves, peak incidence between 5 and 15 years, and is common in lower income families where overcrowding exists, occurs more in the spring and winter months, may not occur for 1 to 6 weeks after strep throat. So the cardinal manifestations are wandering joint pain, skin eruptions, chorea, and inflammation of the heart. Diagnosis may be made using the modified Jones criteria. This is the updated criteria suggests that the presence of 2 major manifestations and 1 major or 2 minor manifestations with supportive evidence of a recent strep infections indicates high probability of rheumatic fever. So treatment drug of choice is penicillin over a 10-day period or erythromycin if the child's allergic to penicillin. Long-term medication therapy could do an IM penicillin G, very painful injection given monthly to children with the history of RN or evidence of rheumatic heart disease for a minimum of 5 years or until the age of 18. So treatment nursing care, NSAIDs to decrease fever and pain. Steroid use is reserved for severe cardiac symptoms. You want to observe the child for signs of Cushing's. Bed rest until the SED rate returns to normal levels. Nursing cares are organized to decrease stimulation, provide good skin care, encourage adequate nutrition and fluid intake, and provide good oral hygiene. Children will need prophylactic treatment prior to any dental procedures. So for prevention and prompt treatment of strep throat is very important. How can strep throat be prevented? Hand washing, not drinking or eating after other people or being around someone who has strep, and the child must complete antibiotics as prescribed for strep throat even if the child feels better. Provide education, education, education. Let's talk about hyperlipidemia. That's an excessive fat and fat-like substance in the blood. LDL and HDL, family history, children with parental history of cholesterol levels exceeding 240 milligrams per deciliter, or family history of early cardiac death, usually under the age of 55, should have their cholesterol levels tested. Results over 170 should be monitored closely and nutritional guidance given. You want to look at table 42-3 on page 1346 for classification of cholesterol levels in children from families with a history of heart disease. Also look at page 1348 for evidence-based practice, cholesterol screening for children. Okay, cardiac dysrhythmias. Abnormal heart rhythms can occur in children with structurally normal hearts. They can be classified in several different ways. You want to be sure to review pages 1347 to 1350. Review the case study on SVT on page 1350. Remember, treat the patient, not the monitors. Okay, pulmonary artery hypertension, a group of rare disorders that result in an elevation of pulmonary artery pressure. Clinical manifestations can include dyspnea with exercise, chest pain, and syncope. Cardiomyopathy, abnormalities of the myocardium, which the ability of the muscle to contract is impaired. Possible causes can be genetics, infection, deficiency states, metabolic abnormalities, collagen vascular disease. Most cardiomyopathies in children are considered idiopathic, which is an unknown cause. Divided into three categories. Manifestations are according to the category. Treatments directed towards correcting the underlying cause, which may be difficult considering the cause may be unknown. When unable to correct the underlying cause, treatment guidelines follow heart failure treatment guidelines. Okay, systemic hypertension. Systemic blood pressure increases with age and is correlated with height and weight throughout childhood and adolescence. Significant hypertension is considered when measurements are persistently at or above the 95th percentile for the child's age and sex. It's called secondary hypertension when it can be explained as a result of a disease process, such as renal, congenital, vascular, and endocrine disorders. Common causes of secondary hypertension. Blood pressure measurement. Pay careful attention to the size of the BP cup. If it is too large, you may get a lower reading than it actually is. If it's too small, the reading will be higher. So for management and prevention, it's the same as adults. You do weight reduction, diet modifications, and lifestyle changes. Then we have Kawasaki disease. Affects children under the age of 5 typically. Causes reaction to toxins produced by previous infections. Diagnosis is made based clinically on signs and symptoms. Manifestations, usually abrupt onset with a sustained fever, lasts about 5 days and doesn't respond to antipyretics or antimicrobials. They'll have the strawberry tongue, erythematous rash with swollen hands and peeling fingertips, palms, toes, and soles of feet. Treatment and nursing care, they'll get IV gamma globulin, aspirin to prevent blood clots, may be placed on Coumadin if aneurysms are detected. Nursing care is symptomatic and supportive. Child may be placed on a long-term. Okay, so let's talk about shock. Circulatory failure, inadequate tissue perfusion resulting in impaired cellular metabolism, deprives cells of essential oxygen and nutrients, forcing cells to rely on anaerobic without oxygen metabolism. Less energy is produced, and lactic acid, a byproduct of anaerobic metabolism, causes tissue acidosis and subsequent organ dysfunction. You want to look at box 42-12 for types of shock. Box 42-13 for clinical manifestations of shock, and Table 42-4 for age-specific vital signs and lab variables in septic shock. You also want to review shock in your med-surg and be sure to read pages 1355 to 1359. Here's a little review about renal compensation in shock and how it affects the blood pressure. This is the end of the lessons of cardiac dysfunctions in the pediatric population.